ARDS, Ards, Acute Respiratory Distress Syndrome. It is a life-threatening acute inflammation of the air sacs, that is the alveoli of the lungs. This is a very critical disease which needs mostly intensive care, admission in the hospitals, and has to be provided by artificial ventilation. The function of the air sacs is gaseous exchange, that is, to expel the carbon dioxide from the blood outside the body and absorb the fresh oxygen inhaled during inspiration into the blood for the function of the vital organs of the human. So in this disease, there is include acute inflammation due to certain reasons by the reaction of the immune system of the body that produces cytokines, chemokines against the pathogens and the foreign body, which immune system consider dangerous to the body, are unknown and harmful to the body. So with the result, there is production of edema, that is, exudate or fluid is filled up in the air sacs. So the process of gaseous exchange is diminished and disturbed. So the supply of the required supply of the oxygen in the body is decreased. Therefore, the fatigue of the various vital organs happens, which leads to the fatality. This edema is bilateral pulmonary infiltration and is non-cardiogenic in etiology. So this process is an acute and critical and life-threatening to the body of the patient, as there is deficiency of the oxygen supply to the various vital organs and the whole body. The function of the alveoli is reduced, diminished by the filling of the fluid in the lung parenchyma. The etiology is sepsis, which may be intrinsic or the extrinsic. I mean, the infection particles or the pathogens, they enter during inhalation or the respiration period through the airways from the atmosphere, and they come into the air sacs and produces the inflammation, or already infection is present in the various other organs in addition to the lungs, and the germs or the pathogens, which may be bacteria, virus, fungi, they travel through the blood, that is, there is septicemia, and come in the lungs and reside in the air sacs and produces or damage to the air sacs due to the action of the reaction of the immune system, resulting in inflammation and the production of exudate. This exudate, it consists of water and protein, which is leaked by the process of inflammation from the capillaries, which are present in the inner lining of the air sacs. This gaseous exchange process is produced by the air sacs and the capillaries, which are present in the walls of the air sacs, and the carbon dioxide is exhaled and the fresh oxygen is absorbed in the capillaries by this process of gaseous exchange. So in this disease, this process, vital process is disturbed and the demand of the oxygen of the body is not fulfilled. That produces a life-threatening situation. In addition to sepsis, there is other causes, that is pneumonia. So pneumonia is pathogenic, bacterial, viral, and the fungi, they also produce inflammation or consolidation of the lung parenchyma, or the portion of the body that is lower respiratory tract, which is responsible for respiration or the exchange of gases, supply of fresh oxygen, and exhalation of the carbon dioxide from the body. There is other aspiration pneumonia, that is the foreign body which are not pathogens but food particles or other objects, especially the perfumes, odors, and the tobacco smoke. They are very irritating one. They are, when inspired, that is when they come in to the surface of the the air sacs, they produce irritation and inflammation, due to which there is accumulation of fluid in the air sacs. So the process of ventilation is disturbed, and the ventilation process is very basic and primarily essential for the life of the human body. In addition to these other factors like acute pancreatitis, they also produces the ARDS, that is acute respiratory distress syndrome. Mostly it is hospital acquired one. The persons with weakened immune system, if they are admitted in the hospital due to other diseases like the surgery or the other medical pathologies and treatment, they catch the infection in the hospital from other patient in the wards, and they produce this acute respiratory distress syndrome. So this is the etiology of this critical and the life-threatening disease or the syndrome.